Welcome to Dr. Warrick's podcast channel. Warrick is a practicing cardiologist and author with a passion for improving care by helping patients understand their heart health through education. Warrick believes educated patients get the best health care. Discover and understand the latest approaches and technology in heart care and how this might apply to you or someone you love.
Hi, my name's Dr. Warrick Bishop and I'd like to welcome you to my podcast station, my videocast station, and of course to the Healthy Heart Network. Today I'd like to share with you a patient experience because it may be a question that you've had yourself. Just today I was asked by a patient if my arteries look okay on CT imaging, if I've got a 0 calcium score, can I stop my cholesterol tablets? What a great question. So this comes up a fair bit and I would like to take a moment to discuss it, and I'm sure that someone out there will have had this experience. There's a couple of things to remember here, I think. We know that 0 calcium is a very good predictor of a low risk of event in average people with average sort of risk factors. That's because they're the group of people who are examined when they did this sort of work. The people who didn't get into these observational trials are people with really high blood pressure or really high cholesterols or really bad family histories perhaps. I can't answer that for sure, but what I'm sort of saying is that average people at average ages went into the trials that inform us that low calcium scores are a very good reassurance. Now that's important to think about because if, for example, we took a 50-year-old male who had a high cholesterol, let's say his total cholesterol is 7 or even 8. Let's say his bad cholesterol's 4.5, something like that. These are high numbers. If that 50-year-old male has a 0 coronary calcium score, should we take him off his cholesterol-lowering tablet? To some degree, nobody really knows the answer for this, and so it warrants some discussion and consideration. The first thing that we know is that if he's a 50-year-old male with nothing in these arteries, regardless of his cholesterol level and regardless of anything else, if he has no calcification, then there's probably not any calcium, not any plaque in his arteries, and that's a pretty good sign. It is possible to get plaque in the arteries that has no cholesterol, but it's pretty uncommon. But it can happen, pretty uncommon. The other thing that we want to know, or the other thing that we want to bear in mind, is that when we looked at the data that informs how reassuring a 0 calcium score is, it didn't look at people with super high cholesterols, because most of those people get put on therapy without a second thought. The other thing is this: all our research tells us that high cholesterol levels create an environment where plaque can form. Doesn't mean they always cause it, no, but they create an environment where it can occur. And the analogy I often use is I live in a house that's near the sea, and my house is made out of steel. Now, if I walk around my house today and there's no rust in the steel, does that mean I don't have to think about painting my house ever again? No. And that's because there is a powerful environment for rust formation because I live by the sea. And so to some degree, I wonder if we need to think about cholesterol and arteries in a similar way. If patients have a lot of risk, perhaps from an elevated cholesterol level, then perhaps we need to think about that environment being something that could drive a problem in the future. It just hasn't to now. So how do we deal with these people with a zero calcium score and elevated cholesterol levels? Well, my experience is plenty of people want to get off their statins. And I sort of understand that. It's nice to think you can get off medications because, well, taking medications is a bit of a pain in the backside. And psychologically, it gives you the impression that there's something wrong with you. However, I think it's more complicated than that. We don't have data to guide us in that space, that's for sure. So what I often say to patients is, look, in the ideal world, I would like to see your cholesterol kept down a bit because I recognise that that high cholesterol level is likely to be an environment of plaque formation. And although you have nothing in your arteries at the moment, that's fantastic. But I want to keep it that way. So my stance is normally to say, look, if your cholesterol levels are high, it's probably not a bad thing to be on a cholesterol lowering agent, and that's fully in keeping with all current guidelines. Now, some people will say, oh, doc, I don't want to be on a tablet. Oh, I'll do anything to get off these tablets. Or I'm having lots of trouble with these tablets. That's possible as well. In that situation, then a specific strategy needs to be employed where we recognise that the environment for plaque formation or build-up of cholesterol in the arteries continues to exist, and we recognise that that process is dynamic. And so for some patients, I will say, I'm open to the possibility of you coming off your cholesterol therapy, but we have to continue to monitor you closely. We know that a zero calcium score in an average patient, say an average 50-year-old bloke, is pretty good for 5 years. It's pretty good for 5 years, but we don't know it's good for 5 years in someone whose cholesterol is elevated. So I will often say to these people, I'm happy for you to come off your statin, but we need to put in place a strategy of surveillance to make sure that we keep a very close eye on anything that may develop. If there is a spot of rust or a spot of cholesterol in the pipes, we need to know straight away. So I'll often say, look, as long as you're able to keep off the cigarettes, keep your blood pressure down, keep your weight under control, keep regular exercise happening and eat well, then come off the medication, but we need to repeat image in, say, 2 years or 3 years. But sooner than that regular 5 years, and I will pick that time or discuss that time with the patient based on their age, their other risk factors, their potential family history, lipoprotein a, their weight, exercise, etc., etc. There isn't a clear-cut answer here. In general terms, I think keeping their cholesterol down makes sense. Certainly if people are adamant that they want to be off that medication if they can, then I like to check the carotid arteries as well, because although it's very uncommon, a zero calcium score generally suggests that the rest of the vasculature is clear, but very occasionally you can have a zero coronary calcium score yet still have plaque in the arteries of your neck. And so I wouldn't think about stopping therapy for any lengthy period of time whatsoever unless I had clear information about what's going on in the carotid arteries of that individual. So, what's the answer to the question? Doctor, if my calcium score is 0, can I come off my statins? Well, the answer is, it depends. It requires a very detailed and considered discussion around the exact levels of the cholesterol, the age of the patient, the sex of the patient, the family history of the patient, the other risk factors the patient has, what other interventions they're going to put in place to mitigate their risk, and then figuring out a sensible repeat scanning interval to make sure that no plaque does develop in that individual. I've given you a straight answer, but deliberately I didn't give you a straight answer because there isn't one. But it's a really important conversation. In general terms, I think if that cholesterol's really in those higher levels, particularly if there's a whiff of family history, then my practice would be to make sure people remain on a cholesterol-lowering agent. If they want to back it off a little bit, sometimes I'm happy to do that as well. But gee whiz, what an interesting space where there's no precise guide to tell us exactly what to do. But there's plenty of stuff to think about. I hope that makes a little bit of sense to you. If you have any questions, please let us know. If you have any ideas for future podcasts, we'd also like to hear from you. For now, I'm going to say goodbye and wish you the very best, and please don't die from a heart attack. Goodbye.
You have been listening to another podcast from Dr. Warrick. Visit his website at drwarrickbishop.com for the latest news on heart disease. If you love this podcast, feel free to leave us a review.